Hi, my name's Lee Hutton and I work for a charity called Change Mental Health. We're a across Scotland charity and we all do different things, but I specifically work for Fife Services and I am the Hearing Voices worker for Fife. I have two other colleagues that also do that. We have a range of services across the charity. We also support carers who are caring for people with a mental health condition. We also support anything that's not voices and psychosis, and this service is called Resilience. So we have several groups that we run. We have two Hearing Voices group. I'm just about to start an LGBTQ plus group, and we have a women's group which runs out of our Methil offices, and that's a mixture of carers and resilience and voices. We also run two carers groups on alternate Fridays, one in Glenrothes and one in Dunfermline. I've been going along to the KY8 project since last year, since October, and obviously before we'd actually specifically went to the drop-in, we had referrals from ADAPT and we knew about each other's service, but obviously not as many as we're getting now. So the KY8 Club is a drop-in for people with drug issues, whether they've still got issues just now or past issues. So often people that have drug misuse problems, sometimes they have voices due to the drug misuse, sometimes they have voices before and they're self-medicating with either drugs or alcohol. And as a Hearing Voices worker, it doesn't actually matter to me whether people are still using or whether they're not using and they still have the voices, because often people will be diagnosed with drug-induced psychosis, but often there's an underlying sort of actual medical problem such as schizophrenia or bipolar or any of the illnesses that can cause psychosis and voices. So people can just turn up at the drop-in and a worker will come over and introduce them and see they've been having problems with their mental health. I'll go somewhere quiet, have a chat with them, see if they would like one-to-one support or to come just to see me at the drop-in, and then I'll ask their permission and I'll maybe do a little pop in a referral for them. Sometimes people, due to the sort of erratic nature of drugs and alcohol, sometimes people can be hard to reach. For normal, when you're supporting someone one-to-one with calls or texts or email or even seeing face-to-face, often they might cancel appointments or not show up for an appointment. So this is something that I am quite aware of, so that's why it's so great to be able to touch base with them while they're at the KY8 project, and they feel relaxed because it's a really relaxed vibe in there. They get coffee, tea, toasties, interact, there's even dominoes and things for them to do. So it's a much more relaxed atmosphere for me to talk to them in, rather than them having to meet me in the community in a coffee shop or something that might cause them stress. So it's actually a lovely, comfortable space. There's space up the stairs if people want to be private, or I can just take a little chair, and it makes it more informal. It makes it more like you've not been referred by your worker. It's a little more like we're all at the drop-in, we're all on an equal footing. You want support with your mental health, which from my point of view, I'm not, I just need to support the person. I see the person. I don't see someone who's addicted. I don't see someone who's schizophrenic. I see a person who has voices or psychosis. And it's been great working with ADAPT. It's been lovely working with the staff. I've been made to feel really welcome. And in terms of picking up referrals, we have picked up quite a few referrals from ADAPT, and it's great because sometimes I can see 2, 3, 4 people in the drop-in that would have actually taken a lot more of my time up if I'd seen one-to-one, and they're in a relaxed atmosphere because they're surrounded by people that are their peers or people that have got the same sort of experiences that they've had. So initially it makes people feel so more comfortable because they're at a drop-in. I'm a mental health worker and I'm just there like another member of the staff. They don't have to feel that they're being interviewed. They don't have to interact with me at all, even if they're one of my cases that's been referred to me, and even they can just sit and play their dominoes or have their toastie. So it's great. It's great collaborative practice at its best.